Welcome to a video looking at public health system in Australia for the Wimbledon channel. Australia's post-World War II system started with the Pharmaceutical Benefits Scheme. This is basically where the government decides on subsidising certain medicines for people who need to take them on a regular basis. Medicare was introduced to Australia in 1972 by the Wimble government. This is a universal healthcare system. It means that 100% of Australians are fully covered by a healthcare system, which is great. But how does it work? Well, it's run by the government, a Department of Human Services. It subsidises medical care and free hospital cover, and it pays for this by a Medicare levy on all Australians. So has it improved health outcomes for Australians? Well, it certainly has done that. Australians in the 1940s had a life expectancy of around 60, and this has improved up to 2014, where males reached 80.3 years and women more than 85. So fantastic improvement overall in healthcare. That is, unless you live in rural areas where it's 1 to 2 years lower, depending on how rural you are, or even worse, if you're a part of an Indigenous community where it's 10 years. Hence the efforts to close the gap. On top of that, we're beginning to see an obesity epidemic. This is basically caused by Australians working harder and leading much more sedentary lifestyles. The Australian government is trying to fix this by mandating at least 500 hours of cooking reality shows every night on television. On top of that, they're asking for teenagers to exercise more in the hopes that that will improve our fitness and stave off a type 2 diabetes epidemic. This has been Public Health in Australia for the Wimbledon channel.